welcome to our Brain Chat Live. We are very, very lucky to have Dr. Robert Mello and Dr. Kyle Daigle here tonight on Brain Chat. Two big, beautiful brains here. So I know a lot of our community in Brain Chat knows these two, but for anyone that doesn't, Dr. Robert Mello is an author of a ton of really, really great books. One that I love is Disconnected Kids. I highly recommend anybody read it, but there's tons of books that he's written, and he's just done an amazing job within the neurology community. And he's also co-founder of Brain Balance Centers, and he is the man behind Melillo Method. So I'd love for him to kind of take over right now and then introduce one of my really good friends as well, Dr. Kyle Daigle down in Louisiana. So thanks so much for being here, guys.
Hey, thanks.
Thank you, Ryan.
Yeah, thank you very much for having us on. You know, this is such a great platform. And, you know, it's all about evolution. I mean, I've been doing this a long time. I've been, 30 plus years in a career. And I tell you, I don't think it has been an exciting time as it is now in functional neurology and chiropractic and functional medicine. It's just, it's incredible time. And for me, I'm like, I feel like a kid because I'm starting another PhD where I'm really immersed in the literature. Also, for 10 years, I spent really working and building Brain Balance, which is doing great. And obviously, we've worked with over 40,000 families in the United States. But then I've also been trying to bring this message and this information across the world. And my book's been translated into, I think, 15 languages now. It just got translated in Japan and by a neurofunctional neurology guy over there, but it was just published, and he sent me a message a couple of weeks ago that it's one of the top books in Japan right now.
Oh, that's awesome.
And, we've been, I just was in Israel. We lectured at a conference. Me and Kyle were both there, movement and cognition. The idea of movement as being foundational to cognitive ability and thought, which, 2004, when I published Neurobehavioral Disorders, everybody said we were crazy. And now it really is the standard. I mean, this same conference was at Harvard Medical School last year. It was Oxford the year before. It's going to be at the Sorbonne next year. And it's just, people are so excited about it. And it's just a really exciting time. And I think that, I've been spending so much time around the world, and Kyle's been there with me to a certain extent, and we go out and lecture around the world, and people are so excited about this. But yet I think that, to a certain extent, people are missing a lot of the message or what we're doing in the United States, because there's a lot of other things going on, and there's a lot of other, influences and different things pulling at people, as well as people trying to build a practice and maintain a living and do all those types of things. So I just wanted to really reconnect and talk about how, some foundational things just, some things are just right and are just there, and they don't change. And they're always, truths are truths. They don't get old. They don't get stale. If anything, they actually become more true as time goes on, no matter what people say. And I think that, there's been a lot of noise with people hearing that, the hemispheric model is an old model and it doesn't fit, and the whole right brain, left brain thing has been debunked. And all of that is completely untrue. And in fact, it's more fresh now than it's ever been around the world. But I think, people need to understand how important it is. And I've been teaching this for a while, and I've been using it for a while. And, I've been more like out there giving my message, and people can listen to it and use it if they want, and they make their choices. But, with Kyle and I recently, because I'm always learning as well too. And it was just such a blessing when he and I got together and I started listening to him and what he's doing, because his stuff, and now that I'm involved with it and you are involved with NeuroSage and, digital reality and, digital medicine and digital therapy, it really is the future. If you've never heard of that name, you better be aware of it, because in a short period of time, if you don't know about it, you're going to be left behind, and you're going to lose your market share because people are going to be doing this. And, Kyle's really the kind of the founder of that. And now to mix his stuff with my stuff, I know that he's been incorporating more than ever a lot of my approach with developmental neurology, with primitive reflexes, with looking at the developmental perspective of somebody in not just in kids, but in adults and brain injury and in everything. And I've been using the NeuroSage, and now with Brandon Crawford is also the laser and with electrotherapies and with all of that together. And I'm getting results like I've never gotten before. And I think Kyle is too. So I just, like Kyle, to kind of give you a little bit of his journey and where, our movement together and how we're bringing this to Atlanta to this life course now.
Yeah, well, I've been in practice for just 8 years now, which isn't a long time, but it's long enough to be able to see a lot of different patients and to see what works and what doesn't work. And, I started out following Rob after reading Disconnected Kids book and started, getting these kids with ADHD and started checking prims. And I was following kind of the basic exercise regimen that Rob mentioned in the book. And I was getting great results. People, had a full practice. But then recently, within the past year, I went to Barcelona and took Rob's advanced childhood development course and learned, Rob actually teaches this thing about how to do a proper examination, gives you all these intake forms. And then from the intake forms and the exam forms, he now makes treatments. So I do this thing, learn quite a bit of information. Well, I go back and it's like, all right, well, I'm going to apply this. So my first kid was this young kid who had a brain injury. And he was nonverbal for 2 years. So he was in a coma for 10 days, nonverbal for 2 years. Parents, they travel, they bring this kid all over, taking different speech therapists, different PTs, different neurologists. The kid's still nonverbal. Well, doing Rob's exam, I literally take his exam from the start and go literally from the intake all the way to the exam. And I start checking all these prims, meaning that these kids, they have these primitive reflexes that babies have that they should typically go away, 6, 12 months of age. They were still present following a TBI. So I asked the mom, I said, well, did he have any history of ADHD? She said, yeah, he had a history of ADHD. So I do this examination. The mom actually, they drove the kid down, they're from about 8 hours away. And she asked me, she says, do you think you get my kid to talk? I said, well, he had with the palmar reflex. So when I literally stroked his hand clasped like that. And then I check, his rooting reflex and his lips, start contracting. I'm like, look, well, first of all, we have to get rid of these primitive reflexes in order for him to start talking. And, Brandon Crawford, as Dr. Melillo mentioned, is a partner in what we're doing. Brandon has this laser. So I took all Rob's protocols in his examination, from his examination, did his treatment. And we got this kid to literally start speaking in 3 days. Which this mom is taking this kid to all the best speech therapists in the U.S. They've been to the best neurologists, which is kind of the story we hear all the time. And this kid starts speaking in 3 days. Now, what was different from what I currently did was, I was still using, NeuroSage and doing laser therapy, but Rob has figured out how to put all this stuff in together. And the results like that, being able to get a kid to speak in 3 days, chiropractic was founded off of getting an adjustment and the guy could hear again. And here we're getting these kids that are nonverbal that can't communicate. This kid couldn't speak for 2 years. And in 3 days, this kid is starting to talk. And it was the most amazing experience. I literally have a video of his mom who's videotaping him because I'm like, look, we watched his palmar reflex go away and his rooting go away. And I'm like, I think he's going to probably talk. And so I tell the mom, I think he's about to talk. And I have that much confidence to tell this mom, start videotaping. And she starts videotaping and the kid actually starts to speak. And, for me as a parent, I have a kid, there's nothing more emotional than to watch a young kid, overcome such a significant challenge and a barrier. Not being able to talk and communicate. And it's really neat too. Like, we work with John and we all collectively work with John, and John's a Navy SEAL, had a TBI, he was laying in the bed, his wife, she's a Pilates instructor, doing great work with him, trying to stimulate him. But yet he really didn't get any really significant gains until we actually stepped in. Once we stepped in, we start seeing John actually start to walk. He's starting to talk better. And it's all following the developmental approach that Dr. Melillo talks about. So, my main purpose of, doing this whole stuff and even bringing Rob involved to be able to speak is just that I'm super passionate about the results that I'm getting in my clinic. From a clinician standpoint, this is the first time that I'm booked out from a new patient all the way up until October. And so for me, and I'm in a small town in Louisiana, and people are flying from all over literally the world to literally come to Lake Charles. and to see that, to be able to book out that much. So from a clinical manager or practice management standpoint, taking what Rob has been able to teach me, it's showing my clinical practice. But the big thing that drives this whole stuff is the results. And so, one of the big things that in functional neurology, I feel like we have a huge challenge is that, we're taught all this information, but it's really how do you apply it? And Rob has done such a phenomenal job of giving you an intake form that's going to say, all right, this kid maybe need more stimulation on the left side of the brain, the right side of the brain. Then you do an examination, and Rob literally puts together all this whole entire, it's like 8-9 pages of an exam that you follow. And then from the examination, now you actually have what treatments are supposed to be done. And it's broken down into the left brain, broken down into the right brain, but then it gets down to specific, like, a big thing for me was eye movements. I feel that, it's just, there's so much conflicting stuff where, there's like the canals in the ear, then you have like the otoliths, and then Rob just does a great job, but he puts together the treatment plan that's based off of the examination. So it makes it so much easier. So some of you guys that maybe don't know a lot about functional neurology, you can literally take his examination and find treatments, just like Disconnected Kids. That book, if you haven't read that book, and I recommend this book to everyone, just like you mentioned earlier, Ryan, it's neat. When I fly places, I'll bring a book with me, and I'm normally reading the book, and now I read his textbook now because, being able to lecture with Rob, it's, to get on his level, you want to read his textbook. The Disconnected Kids book is just so great for a parent. And so being in practice 8 years, I tell parents to read this book. I have never had a parent come back to me and tell me this book wasn't worth it. This book, it's incredible. And again, I get emails all the time for, especially when I travel and fly, and I'll get like a flight attendant who her kid has ADHD or autism, and she sees me reading this book. She asked me about this book. I'm like, look, if you really want to know about ADHD and autism, this is by far the best hands down book. And then it turns around, he goes to another book where he talks about reconnected kids, which is about once you get this kid from being disconnected to how you can actually start managing it. And then there's a nutritional protocol. So, there's a lot of people out there doing functional medicine. There's doctors out there like Dr. Amy Asko that's talking about, methylation with these kids. You have doctors talking about food sensitivities and fecal colon transportation, but the whole core thing is if you do a neurological exam on these kids and you look at what Dr. Melillo preaches, in lectures on, it correlates that nobody assesses primitive reflexes. No one looks at these kids' eyes. And the thing is these kids are on all these ADHD medications. And, you talk to the parent and the kid's normal. He gets on the medication. Now he starts having involuntary movements. He's having tics. Now he's getting made fun of. Or now the kid can't sleep because he's so amped up. Now he's on another medication to put him to sleep. Or then the kid gets super constipated. Or then the kid has really bad eczema. And the question is really what's going on? Do these kids need all these medications? Or is there something underlying? And there's something underlying. And from a physical standpoint, that this is what Dr. Melillo preaches. And for me, as you can tell, I can talk all day long on this because, I see it all day long, but to be able to take all this information and put it into, a great, this is exactly what's needed for this kid. This is what's needed for this kid. And I don't know of anyone that gives, that better of approach. But then it not only just works for kids with ADHD and autism and Asperger's and kids who have savant syndrome, and this stuff's applying to, TBIs, patients who have concussions, people who have autoimmune diseases. I've seen this stuff with Parkinson's. So Dr. Melillo, he came down to my clinic, and it was really interesting that I had a lady, she was, elderly lady who had Parkinson's disease. And he asked me, he says, did you check her prims? And I remember this as I was like, no, I didn't check her prims. And he asked me, he says, why? And I was thinking, I was like, well, she's like 64 years old. Like, why would I check prims? And this is the kind of stuff that he's like, well, it doesn't matter because you're starting to see this stuff. And so, for him telling me this, I checked her prims. She has prims. So then I remember this. I sent him a research paper that I was reading one day over primitive reflexes and aspirations in patients who are in nursing homes. And it showed that literally that when they tested these patients who were having problems with aspirating, that they actually had primitive reflexes, especially the rooting reflex. And it makes a lot of sense that, these patients, they're still having immaturity and they can't swallow. So what do you do for that? Well, this is where he's teaching you guys, that you can do certain exercises. And then even TBI patients. And we mentioned this earlier too, but after someone gets a TBI, we're so focused on like looking at the eyes and checking their balance and their coordination, which is all great because that's all part of the stuff. But what about primitive reflexes? Can they still be present? And then all these patients who have autoimmune issues. Rob's talked about, the left side of the brain increasing the immune system, the right side of the brain suppressing the immune system. So what if a kid had some sort of issue as a child? Maybe he had spinal meningitis or had some sort of, traumatic event. Maybe this kid was, physically abused. And maybe this could have an impact that created a neurological developmental delay early on that is starting to manifest later on. And I see this a lot with TBI patients. You get a TBI patient and these kids had mono when they're 17 years old, and then they have a TBI, and then 6 weeks later, they're getting worse. 12 weeks later, they're getting worse. 2 years later, they're still in the same boat, but actually worse. These kids can't get out of bed, or these adults can't get out of bed. And now they have this virus that's persistent that they had years ago. And then you check their primitive reflexes and they're there. And it's like, you've been to the best neurologist, you've gone to the best, neurological hospital in the country. Did anyone ever check primitive reflexes? And the answer is no. Because why? And again, I was a victim of this stuff before I got involved with Rob. Is you think that once you get an adult, primitive reflexes aren't going to be there, and they're starting to show up. And I've seen this with patients with migraines. I had a guy one time come in my office, and the guy literally, the first visit, he's doing the examination, he stood up in the bathroom, and they're like, hey, he's in the bathroom throwing up. And so I go get this guy, and I bring him back, and I'm like, what's going on? He's like, man, I have migraines. I've been having them for 17 years. It gets so bad I throw up. He said I have them about 4, 5, 6 months, out of the year. I'm like, well, what's going on? He's like, no one really knows. And I checked this guy's ATNR. So I get him on his hands and his knees. I turn his head to the right. His elbow completely drops into the table. And I'm like, oh my God, this guy's like 38 years old. And he's got an asymmetric tonic neck reflex. Then I check his eyes and I see if his eyes can actually converge. And his eyes don't even converge. Literally one eye stays straight. One eye comes in. And I'm like, oh my gosh. And I'm like, has anyone ever told you that, your eyes don't? He's like, no one's ever. They just, check my blood pressure, my pulse, maybe do blood work, and that's it. And so what we did is we just did primitive reflex integration from Rob's, treatment. And this guy comes back and he's like, look, man, like I haven't had a migraine. And I just did a reassessment about 2 weeks ago. And I'm like, man, how are you doing? And so again, this guy's now, migraine free. So it's neat to see that not only is this stuff, applying to childhood development disorders, this stuff's applying to patients with autoimmune diseases. People are having issues with eczema, to concussions, to migraines. And what's even neat too, is even working with patients with chronic pain. So like Dr. Crawford's going to talk about in the lecture about using this laser working on patients who have regional sympathetic dystrophy, where literally their pain is so bad that their legs literally turn into discoloration and they get atrophy, in their muscles and their bones. And there's really no pain. There's no treatment for that. And then here we turn around, we do all this assessment, find all these imbalances. And what really happens is they really just don't have a good brain. And if you don't have a good brain, you can't modulate pain. And if you can't modulate pain, you're going to be in a pretty big bind. So, Rob, I guess from here is just, you can expand on this stuff because, Rob's my biggest mentor and, started SNA, which is our company, but Neurosage was developed based off of a lot of Dr. Melillo's work. And it just worked like this. Rob has figured out that, certain characteristics, certain cases, typically people may have, a left brain deficiency, maybe have dyslexia or might have speech issues, maybe have fine motor skills. And it's neat too that I get kids that are nonverbal and then I ask the parents, I'm like, how's their hand coordination? They're like, oh, they can't even hold something. It's like, well, that speech typically resides in the left side of the brain. So if I stimulate the left hands or, the hands, what's going to happen is the better coordination they get in their hands, their fine motor, we're going to strengthen the left side of the brain, which is where speech is. And it's kind of like a domino effect. And once you get that domino, that primitive reflex sometimes to start to go away, then you start seeing the brain really turn on. And that is where stuff gets really fun and interesting.
Absolutely.
Yeah, I think, the idea is that I think people sometimes, they're in their own vacuum and they don't really they're not really aware of what's happening around them or in other areas. And I've tried to expand it out and really look at everything. I have a degree in neuropsychology. I have obviously chiropractic and neurology. And, so I'm always involved with the research, and I've written books about everything, obviously, and looked at all the research and continue to do that over a 30-year career. And I do it now more than ever. I mean, I look at several papers a day, and I'm always speaking to researchers, and I'm in a position now where people reach out to me all the time. I just had this Turkish psychiatrist that read my book that said he wants to translate it. I had this neurologist from Iran that reached out to me, and all the time. And so, it's sometimes people look at this and they want to just, we like to encapsulate things and kind of simplify it. And, primitive reflex is important, but it's not about the primitive reflexes. People say, well, it's just primitive reflexes and you stimulate one side of the brain or the other. That really is way oversimplifying it. Those are two important features of it. But having primitive reflexes is what it represents. It represents that the brain did not develop the way it was supposed to. And what we know is that anybody that is in the psychiatry, psychology, mental health world, everything is being looked at as developmental now. I mean, 1 in 5 kids have some sort of severe mental diagnosis, and 1 in 5 adults. It's not a coincidence. They're the same people. They may not manifest until their 20s or their 30s or beyond. They may not get bipolar till they're later, or schizophrenia, or severe depression, or other types of problems. But yet, if we know that the research is saying it really starts in childhood and even in the womb. That's why I wrote a preconception book as well. And so the point is that to really put together the best system of looking at anything is that you need to go back and look at development from the beginning and really understand, like what happened with your birth process. I mean, as chiropractors, we've been talking about birth injuries for a long time, but that's an important thing. A lot of people don't ask about that, but what about before? Do you know what your mother was like? Did she have a good pregnancy? When did you speak? When did you walk? When did you meet these milestones? And if you didn't meet these milestones, why? And it's almost always because of retained primitive reflexes. Well, what does that represent? It represents as an immaturity in the brainstem where these reflexes come from. It didn't mature fully. And then if that didn't mature, what else is in there? Well, all the autonomic nuclei, the nucleus ambiguus, the nucleus of the vagus, the ventrolateral medial nucleus for the sympathetic system. All these other nuclei are there, the cranial nerve nuclei. We're looking at eyes, we're looking at the inner ear. What else is in the brainstem? The vestibular nuclei. So, we know that someone may have a brain injury later on, and we know that they may get vestibular symptoms, and they may have oculomotor symptoms, and they may get autonomic dysfunction. But again, the idea is, okay, well, was that superimposed on a developmental issue? Because that adds another complicating factor, because now you're going to try and work on those areas that never fully matured. And so it makes it a hell of a lot harder. This injury may have brought it to a different level, but, the other thing that I talk about a lot is also adverse childhood experiences, ACEs, which is also a big thing in the literature and in the medical and psychiatric world. And we know that it alters brain. I mean, when we talk about ACEs, adverse childhood experiences, the really fascinating stuff about this literature is that if you have 4 or more of these ACEs, you have a 400 to 1,200% increased risk of every type of disorder: diabetes, heart disease, cancer, depression, suicidality is increased 1,200%. So all of the things that people die from and struggle with and suffer from, all the most common chronic illnesses are related to that, and they die 20 years earlier on average. Right? A guy, one of the leading researchers in the world, Russell Barkley, on ADHD, he did a 20-year follow-up study recently on people with ADHD. And what he found was that they died 10 to 13 years earlier on average, right? Why? Because with ACEs, when they looked at why are they dying earlier, why are they getting these, they came to the conclusion that it was altered neurodevelopment, right? And so anything that alters neurodevelopment, ACEs can do it, but that's probably not the most common. There's all these other factors, but they cause altered neurodevelopment. And when you do that, it may affect you throughout your whole life, and you may struggle or be able to manage it. And then you have an injury on top of that. But now you look at the complexity, and I'm going out to Colorado to meet with a bunch of patients out there because there's a couple people with a brain injury, car accident, but then they have a history of ACEs and child abuse and neglect, and they had some head injuries when they were a kid. And then they had a history of childhood dyslexia, of developmental dyslexia. So, you know, they asked me, who else looks at the combination of all of those three things together? And I said, nobody. But what I'm doing and what we're teaching in the course and the people that we work with. But it's one of those things when you hear it, you go, wow, yeah, if you don't really understand all of that and how it interacts with one another. So it's what primitive reflexes represent, the lack of maturity. I kind of use an analogy that I say, you know, to people that it's like, you know, you're trying to teach a kid how to ride a bike and they have training wheels on. What happens if you never take the training wheels off? They never really progress to really being able to be fully independent in riding. And so primitive reflexes are kind of like training wheels for the brain. And if they don't go off, then the brain doesn't mature. But what's really fascinating is like working with John Grant, who's a Navy SEAL, who seemed to have great development and had great family. You know, he ends up with a brain injury, and what happens, he goes back to being a child. I mean, if you heard his speech, it's like child speech, right? You've been there, you've talked to him. So he was violent, and Kyle went there and it completely changed that. You know, just using the neurosage and doing what Kyle did made a huge difference in their life. I mean, you know, he was violent and really aggressive and really completely out of it. But then when I went there, I looked at him from a developmental perspective. And so Laura had him, you know, on these parallel bars trying to walk. And of course, everybody wants to get him to speak and really talk and act independently. But from a childhood development perspective, one, the primitive reflexes are back. So now, okay, so that means what, first of all, were they there to begin with? That we don't know. But if they're there now, then we know that there's areas that are immature. We're trying to get him to walk, but he couldn't even, you know, he couldn't even crawl. He couldn't get on his belly, and he had no core stability. I mean, you're trying to talk about gaze stability. If someone doesn't have core stability, you're never going to get gaze stability, right? Because they're built on top of it. And this is what I teach in the course. And these are the forms that Kyle's saying that I built together. I put this all together in this systematic way of looking at everybody from a developmental perspective. And then, you know, every time you examine somebody, that should turn into a treatment, right? There should be a menu of options you have. And again, the idea of right brain, left brain, it is incredibly valid. Anybody saying that it's an old model is really doing everybody a disservice. It's really dishonest, and it's actually unfortunate because it's so important. Anybody that's ever done it, that's worked with it. I had one young student who came to when I did a module in Chicago, and he said to me, you know, I went to this one functional neurologist who said to me, oh yeah, that was an old model. Dr. Melillo stuff is an old model. And, you know, the right and left brain doesn't work. And he said, and then I followed him around his practice, and everything he did was right brain and left brain. Everything he said to me was, I'm going to stimulate the right brain, or this is a right brain or a left brain. So, you know, it's disingenuous to say, because, you know, anybody that's been working with this, if you really are good at it, you know that it works. I mean, and to deny that, it's not an old model. And again, we had talked a little bit about the Harvard study in the past. Well, there's a white paper that came out. Anybody that wants it, I'll forward it on to you, Ryan, and we can email it out to them. And this is only on the preliminary data. The full study is going to come out. It's a double control study. It's a full, you know, this is at McLean Hospital, the #1 mental institution in the world. It's at Harvard Medical School. This is a lab called the Lab for Developmental Biopsychiatry. They've been around for 30 years with some of the top researchers in the world. So this study also they were looking at cognitive measurements. They used something called a quotient machine, which is what they made, which is basically a classic CPT, continuous percussion test that's used to test for ADHD, like a TOVA test. And then they added an infrared motion capture camera to measure head movement. And they believe the combination of that makes it the most accurate test available. And they've obviously published tons of research on this. And so they did that study. They also did a Cambridge study looking at spatial working memory. And then they also did some of the most cutting edge brain imaging and functional connectivity measurements with a machine that there's only 6 of them in the world. And this was a 15-week study doing hemispheric-based exercises, primitive reflex exercises, and sensory stimulation, along with interactive metronome. And, just doing them 15, 20 minutes. It was a home program. It was relatively unsupervised, 8 to 14-year-old kids with ADHD. And what they found afterwards, what they published was, one, in the quotient machine that they had seen, in the CPT portion, what they said was they actually wrote, actually I can kind of quote what they wrote to you here so that you can actually hear it. But basically what they said following that was that, let me get to it, okay. That attention portion on the quotient that they looked at, that they looked at spatial working memory, but they looked at the quotient machine and the results. They said that those who completed interactive metronome and brain balancing training at 40% or greater improvement in quotient measures of hyperactivity or inattention. And on the measurement of spatial working memory, they also had a significant increase. This is a degree of improvement that we have not previously observed in children with ADHD unless they were receiving medication, and then only if they were receiving correct medication at an optimal dose. In the spatial working memory, they also showed significant changes, but in the motion capture data, where they're looking at actual motor activity, so physical motor hyperactivity, they show, and you see it on the paper, they show these like squiggly lines. And I remember when I was at the lab and they showed me this for the first time, the researcher was smiling, and he's not a guy that smiles much. And he said, they showed me this and they said that basically, did I do that?
Oh, Kyle, I think you're sharing your screen.
Yeah, I'm going to pull up the paper while you're talking, Rob. This is
Yeah. Okay, good. So if you scroll down a little bit, Kyle, there.
Thanks, Kyle.
Good job.
Yeah, I'm
go down a little bit more, go down, keep on going.
I knew you were doing something over there. I saw your eyes working. I was like, what is he working on over there?
Well, he's the techie guy.
Yeah.
Okay, so go right to there and go a little bit further down. Right, so you see what they're doing is every 5 minutes they're capturing this motion capture. And you see the squiggly lines on the top are the head movements, right? And the squiggly lines on the bottom is after the 15 weeks of going through it. And they say on that, go down a little, Kyle, so I can read it. It says measures of hyperactivity. So following, go a little bit up so I can just get to that, looking at that. So note that prior to treatment, the subject was in the top 3 to 15% of the most hyperactive individual within their age range. Following treatment, their activity measures were in the 29th to 65th percentile, indicating they were no longer clinically hyperactive and well within normal range. Now, I looked over to the guy when he showed me this, and he said, we have tested everything. We have looked at every treatment, every drug, every behavioral intervention, and even though they've improved some of the CPT data, nothing has ever changed the motor activity, ever. Nothing at all, not one bit. He said, not only is this improved, but it's completely normalized. He said, we've never seen, nobody's ever documented anything like that before. And what does that represent? It means that they're physically not moving, which means you change the basal ganglia, right? It means they're no longer hyperkinetic. You change at least the motor network on the basal ganglia, which is huge, right? Then if you scroll down further, all the way to where they talk about the imaging data. So this is preliminary neuroimaging results right there, Kyle. So this whole page or more is the physical changes they've documented in functional connectivity in all different areas of the brain. And it's also lateralized, which means that it was affecting, the treatment was based on directing it towards the right brain primarily. And what it showed was that the changes were predominantly in the right brain, but it normalized activity that was abnormal on the other side of the brain. So again, now at the same time they started this study, they also, unbeknownst to me, had gotten a online OT PT program that was doing generalized exercises. And so they thought it was similar to the exercises we were doing. They weren't doing primitive reflexes, and they weren't doing hemisphere specific exercises, right? Or stimulations. And they dropped that study after 6 months because they were not seeing any results. So that they realized that the only main difference were those two things. And it was dramatic. So again, the full study of this is going to come out soon. But so this is just right now current. So anybody who say this is an old model, this lab is one of the leading labs in the world. They wouldn't study an old model, right? They study this because this is also their model. They believe in this, the hemispheric integration idea, that the two hemispheres aren't integrating. And everybody knows that that's the problem. It's lack of integration. But why is there a lack of integration? Because there's immaturity of development on one side more than the other. And when there's immaturity on one side, you get overactivity on the other. And that is the basis of it. That's what ADHD is. And so the old model, as they explained to me, was medication. The old model is the biochemical approach. That is the old model now. And, to be honest, I love functional medicine, and diet and nutrition, it's important, but it's a biochemical model, right? It's really a similar model as medication. It's a better way of doing it. And of course, there are people that have predominantly problems that have to do with diet and nutrition and everything like that. But it is very rarely the primary issue, and it doesn't really affect functional connectivity. And what is functional neurology? It's about functional connectivity. A couple of months ago, on the cover of Scientific American, was a picture of a brain talking about how do we become us, right? Where does consciousness come from? And the basis of it was, if you read the article, it was talking about how everything now is about functional connectivity and network connections and network dynamics. And the main thing they're looking at is what's called graph theory. Now, our lab, in 2013, we published a paper in the Journal of Autism and Developmental Disorders and we were the first lab to do a large study using graph theory and functional connectivity in autism. And what we showed, is that there are these hubs in the brain and that form, and that they change in maturity. And what we showed was that, how they connect with one another is really the basis of efficiencies. That's what you're looking at, is cognitive efficiencies. And it's more of an engineering principle. And we showed that in the left brain, there was over connectivity. In the right brain, there was under connectivity. And because the hubs were immature, and because of that, the two hemispheres couldn't really communicate and integrate. How does that relate to primitive reflexes? Well, why is this immature? Because that brainstem never matured, because the primitive reflexes never went away. And especially if they're asymmetric. So if you want to talk about functional neurology, that is functional neurology, functional connectivity. And I've been talking about this for 20 years, and unfortunately, there's not enough people really talking about that. So, now being able to combine this with Kyle's stuff and Brandon and being able to really target, we've been working really hard on taking all of this and taking those systems and creating very condition-specific protocols. This is what we're going to present in Life. I'm also presenting it in Bulgaria. We've done it twice preliminarily in my advanced seminars, and I have another one in Chicago in October. That's the second part. But it is just an incredible world right now where we have these tools. People have said to me for years, how do you target the dorsolateral prefrontal cortex on the right or the orbital frontal on the left? Well, the laser can go right there, right? That's one thing, as well as other things that we know we can do. But with electrotherapies, right now I've been using TENS unit in hemispheric ways, and it's been for 30 years. And now the FDA just approved that a TENS unit-like device for ADHD and depression, one being more of a left brain problem and the other right brain problem. So, this is really exciting times. And I think what we're going to be presenting here is really a whole new course for me. I've never presented a lot of this with these protocols. Brandon and Kyle are going to be presenting as well. We're also going to be presenting really cutting edge protocols for interactive metronome, because that's another unbelievable tool. And again, this has been proven in this Harvard study as to how powerful it is. So, these are exciting times, and I hope people can join us there. And again, Kyle is, like this independent voice of the youth. I'm an old guy, So people can look at me and go, well, his stuff is old because he's old. But getting a young guy like him who's really on the cutting edge. And the real difference, like when I met Kyle and Brandon, they were kind of doing, my stuff, and they were doing it, but it wasn't like 100% commitment to like the hemispheric model. And I'd say to him, like, again, why aren't you looking at primitive reflexes in Parkinson's, or why aren't you looking at on everybody? And also, like, Brandon was using the laser on both sides and and I said, why aren't you doing it on one side? And then we did a quick test looking at primitive reflexes, and sure enough, when we did it on one side, it worked better than when we did it on both sides. So I think Kyle, he had got a little confusion with some people that had said to him, well, nobody really looks at that anymore. And then once he started really doing it, it's there. And so again, I just want to get that out there to people so you know where this really is. And so you're not left behind, because listen, it's a competitive world in the healthcare market, but more importantly, the world needs this stuff. And I don't do this for money or for ego or anything, and neither does Kyle. We just want to change the world, and we want to make a difference. And that's why, in the past, I'm not an aggressive person going out there going, listen to my stuff. If you want to listen, you listen. If you don't, but with what we've seen over the past couple of years, I've been working all around the world with these severely autistic kids. The most difficult thing, the most difficult people you can work with. Just work with a kid today from Australia that's with me for this week in New York City at my practice. And, working with this kid, I got him to do, I can do primitive reflex stuff with him. I can use the laser. I can do things, but to really get him to be stilled so we can really combine and integrate this. I stand him up on the Vibe plate. He looks at the NeuroSage. We put on the virtual reality screen. He lets us put headphones on. He lets us put eye lights on. He lets me put smell. He lets me put a TENS unit on him. He lets me use the laser on him. And so now we're getting all these modalities, and the parents are sitting there. He was there for 15 minutes. And the parent said he's never stood for more than 1 minute in his life in any one place, right? And the parent said, I did this with him yesterday. For the first time, he didn't scream all day. Like, he didn't make those Tourette's type noises all day. He was calm and quiet all day. And then after this treatment today, he actually said a word. And it was the parents were like, this is the second day I've seen him, right? So again, using Kyle's stuff, we'd have never got a kid. I'd work with him, but to get a kid to stay there so you can actually do something, it's just really phenomenal. It's just very exciting, and it's too exciting not to really tell people about.
Yeah, well, Ryan, the main thing for this whole stuff, man, is is just results. And when results start driving your practice, starts flourishing, people start flying in from all over the world, and that's what it's all about, is just really making a difference. And for me, I'm just super grateful that Rob is, he could literally harness all this information and keep it to himself, but he's out there teaching, and he's teaching people everything. And, he's giving away, all of it. He's giving away his exam, his intake forms, his treatments. And, we were in some of these courses and taking it, you ask the question, well, how do you treat it? And it's like, well, and they kind of circle around it. But, Rob's actually in his course, he's giving you exactly how to treat. And if you ask a question like, what is it, how do you treat it? He's going to give you that answer. But the best part about this is, lecturing, going to courses, and you take these courses and you kind of leave and you're like, well, I got all this information. It's great, but how do I apply it? And, we're doing hands-on where we're going to literally have the laser there. We're going to show you like where to put the laser at, which settings to use with the laser, how to use NeuroSage, how to do, left brain, right brain stimulation, how to do eye movements, and be able to do it hands-on. It's a more effective way to learn. And then when you show up to Monday in practice, you know exactly what to do.
Absolutely. Yeah, that's very important. I remember we talked about this earlier, but I had a traumatic brain injury case where you had spoken a few months earlier to me, and you said, you got to check primitive reflexes. And it was a young guy, severe TBI, couldn't speak, similar to what you experienced, Kyle. And I channeled my inner Dr. Melillo, and I used a lot of the protocols looking at primitive reflexes, and he's back to school speaking, A+ student. So I can't thank you enough for all the work that you put into this. And I know we've talked about that book that you've written. It's amazing stuff. So what, in September, you're going to be at Life University on campus. What are the specific dates?
Good question.
I think it's the 21st and 22nd.
Yeah.
Is that right?
The 21st and 22nd.
Okay, September
22nd. Yeah. So Yeah, so it's the 21st and 22nd, and then it's going to be basically every month. There's going to be 7 or 8 modules. Again, each one is going to be condition specific. We've broken it down more than we have in the past, and we're going to have different protocols for the laser, for the neurosage, for all the things that I do, for electrotherapy, for interactive metronome. And like Kyle said, I'm giving you all the forms. I'm going to give all the steps. I'm not holding anything back. We've all known instructors that kind of tell you only part of it, or kind of try to purposely frustrate you, or, try to keep their secrets. And, I'm so throughout, I just want to share it with everybody. I just want it to go out there so that everybody's using it and making a difference, and getting the results that Kyle and Brandon's getting now, and that you're getting, Ryan. And like with John, again, this is a guy who suffered. He's a hero, and his wife is a hero too. And they suffered for a couple of years. She said she went into a acute care facility for his brain, and she said it was literally like they were torturing every day. It was horrible, and they had no hope. They came home. She was working. It wasn't until Kyle went there and changed their life. And then when I went there just a couple of months ago, and we started adding the idea of primitive reflexes and looking at from a development, and she's a Pilates expert. So I was like, Laura, you can't get him to walk until he can do things on the ground. And she was like, oh, of course, right? I know that. And, so she started using it. She started using hemisphere, like different things like a TENS unit and the highlights and all these other tools that we have. And, you could just see on a daily basis, he was getting stronger and stronger and stronger. And then she got him on his belly and get him to do kind of like crawling movements. And then he could get up on hands and knees, just going through these developmental stages. And now he's walking almost independently. And now he starts to speak, right? Because a kid doesn't speak until after they walk. You don't get a kid that's in the crib that's going to be actually speaking. So now he's actually speaking. And he's writing and he's answering questions. And so it's so applicable to everything. And this one system should be the foundation of everybody's practice. And then all the other stuff, the nutrition protocols and the other things are all great and important. And, you'll be able to isolate that out and triage it. But, this developmental perspective is just so critical in all of them.
Well, I'm excited that I live here in Atlanta, so I don't have to travel far to see you guys. But yeah, I can't thank you guys enough for all the hard work you're doing. And then we'll have that in September, and then you're both gonna. I know, Dr. Daigle, you'll be speaking at another conference in October, but you're gonna swing by Vegas. So for anyone that's interested, we do have our 10th annual IAFNR conference in Vegas, and both of these guys will chat with you when they're not on the stage, at any time, any place, about all this stuff. So, Dr. Melillo is one of the reasons why IAFNR is still here today. And, we'd love to see anyone out there in Vegas too. And thank you for all of the work that you've done with IAFNR, Dr. Melillo, as well.
Yeah, well, it wouldn't continue without guys like you and David and, and all the young people that are really doing things. That's what I really loved about it, was that we really attracted a lot of young students and really people that wanted to make the world a better place and be a friendly place. When you come there, you feel really kind of loved and warm, and it's warm fuzzy, which you don't get at a lot of conferences where you feel like everybody's jealous and, and I'm excited to speak there this year. I have so much new information that I really want to present, and it's really cool stuff. So I can't wait to be there and see all you guys. So it's going to be a great time. It's also a beautiful venue.
Awesome. Yeah. So anything else you guys would like to add before we wrap up? I know there's a couple of questions that people post on Facebook. My phone died, so I'm not able to look at them, but I will make sure after we end the live, I'll go through and answer any questions that people had. But anything else that you guys would like to add?
No, just I think that's about it. I'm also doing an advanced course. If anybody out there is I'm doing the second part in October. And I'm also teaching up in Montreal to a bunch of people in posture and orthopedics. And even in our course, we're going to be talking about pain management as well, because that's another huge thing that, the neurosage is really working on. So, this is really going to touch on everything that a typical chiropractic practice or anything works in. And people have to realize, I had a couple of people, me and Kyle were talking about it. There was one guy that was a chiro that when we put out the Harvard thing, he kind of almost got agitated about it. Like, as almost feeling like it was threatening, because it was almost like saying, well, you don't need chiropractic because you didn't do adjustments as part of the study. But I look at it differently. What we're using is somatosensory stimulation, and we're doing it from a hemispheric model. And what it proved was that that type of stimulation changes the brain more powerfully than anything else, especially when it's used directed towards one hemisphere. And so if exercises and light and movement, if that changes it, then certainly a chiropractic adjustment, which I think is the most powerful form of somatosensory stimulation, will change the brain even more so. And I use it all the time in my practice. It's the best tool I have. So it doesn't negate chiropractic. If anything, to me, it actually proved it, that what we do actually changes the brain in incredibly powerful ways.
Absolutely.
Yeah, I think that's well said. You can't say better than that. So, yeah, and the research, I mean, that stuff's great. I'm looking forward to the final paper, and I mean, some of the findings there were just awesome. So,
yeah.
He
actually said to me, Ryan, that nobody's ever shown changes in the brain. Nothing, no study has ever shown changes in the brain like that they're aware of. So again, nobody in our community has independent verification like that, right? We all have papers we put out there, and it's great, but there's no one that has independent verification at this level to this degree. So at this point, this is kind of the biggest thing we have to hang our hat on. So we should all be very aware of it and really promoting it and getting it out there to people.
100%. All right, well, I'll go ahead and I'll end the live, but what we'll do is I'll make sure I add all the links to the courses and your other courses that you have. And yeah, we'll make sure we add all those into the videos, and we'll share it around. So thank you everyone for tuning in, and everyone have a great night.